My name is Clyde Cicotte, and I'm a prostate cancer survivor. When I found out I had prostate cancer, I had it treated at Orange County Cyberknife. I'd like to share my story with you and maybe at the same time help you decide how to have your prostate cancer treated. I went in for my routine physical examination with my family doctor. Everything was okay. The only thing he mentioned is that my PSA was a little high and he'd like me to have a biopsy and go see a urologist. Just routine, nothing to worry about. So I scheduled the biopsy, and a few days later I got a call back from the urologist. Bingo, I had prostate cancer. Not a fun thing to hear. So I went to see the urologist a few days later to find out how to be treated. His recommendation to me was surgery. That's all. So I went home and started doing some research. I found out that there are several ways to treat prostate cancer. Let me name the 5 most popular ones. First, there's surgery. Second, there's robotic surgery. Third, there's radioactive seeds. Fourth, there's regular radiation that's been around for a long time. And fifth, there's Cyberknife. Let's take them one at a time. Surgery, you know, where they completely cut your prostate out. You could become incontinent, you could become impudent, there's bleeding, hospital stay, not a fun time. It wasn't for me. Number 2, robotic surgery. Really the only difference is that the robot holds the knife. You still have the possibility of incontinence, you still have the possibility of impotence, there's the pain, etc. Number 3, radioactive seeds. They put small radioactive seeds into your prostate. They have to anesthetize you for this. It's not as invasive as options 1 and 2, but it's still invasive. Number 4, regular radiation. Because of the location of the prostate being right next to the rectum and right next to the bladder, accuracy is very important. Regular radiation, therefore, delivers a much lower dose to prevent after effects, resulting in 44 treatments. Number 5. Now let's talk about Cyberknife. Because Cyberknife is so accurate, your treatments are completed within 5 days. It's accurate to within 1/500th of an inch. And incidentally, the word knife is in the word Cyberknife, but there is no cutting. This is strictly radiation. And because of this accuracy, there are little to no side effects. In fact, it's like it never happened. Now let's talk about how and where to have your prostate cancer treated. Orange County Cyberknife and Radiation Oncology Center. Dr. Harsoli on staff. It's like being treated at a 5-star hotel for 5 days. Once I learned how accurate Cyberknife was, it took me about 1/500th of a second to decide where I was going to have my treatments. Gentlemen, do your research. I'm sure you'll come to the same conclusion that I did.